And on behalf of WeWorks for Health, I truly want to welcome you here today. Thank you. We Work for Health is a national organization of local business leaders, labor, pharma, patient advocates, and much more, dedicated to supporting policies and initiatives that foster research and access to medicine. As many of you also know, I am president and founder of Distinctive Public Affairs. As a small business, now 15 years later, trust me, I really understand the importance of today's discussions. And I'm really, really honored with the panel that we have put together and the special guests that have come from far away to be here with us. I have the pleasure of introducing someone that always says presente as well, Lisa Sorin, the first female president of the Bronx Chamber of Commerce. She's dedicated and a passionate leader with a heart full of gold. Without further ado, let me introduce Lisa Sorin.
I am thrilled to welcome you all today to this important discussion on healthcare and small business. As president of the Bronx Chamber of Commerce, I see firsthand the challenges our local businesses face every day, from rising costs to workforce retention to navigating complex policies. Healthcare is one of the biggest concerns for our small business owners, yet it is often left out of the broader economic discussions. That is why this conversation is so critical today.
This is amazing because, in the words of my dear sister, the president and CEO of the Bronx Chamber of Commerce, Lisa Sorin, we love to say, the Bronx means business. We are committed and dedicated and driven in this work. We are intentional in supporting our small businesses and stimulating our economy, advancing job growth and economic development. And when you talk about healthcare and small business and the intersection, you have to realize a lot of this work is driven by policy. What can we do to look at policy, thinking outside the box, creative and innovative ways and approaches of supporting our small businesses and entrepreneurs and making sure that healthcare is a critical part of this conversation.
What are the biggest healthcare challenges facing small business today?
It's not only an issue with healthcare, it's an issue that affects communities at large.
The challenges that I face in trying to develop healthcare for my employees has been a really big challenge. Same thing with our small business.
This is not a new issue. We've been talking about this stuff for years and years and years, and you go talk to some of these folks and they'll agree with you and look at you in the face and I'm fighting for you and I'm gonna do it, and nothing happens. But we can't give up.
And to have a good workforce, you have to have, in this day and age, quite frankly, good benefits. And if you don't have a good health care program, and it's not a robust program, that workforce is going to go somewhere else.
I can talk to you about the businesses that cannot afford health care at all. And it has a very bad impact on them because they can't grow.
Many people are not familiar with the 340B program. Heck, many of us don't even know what 340B patients.
The intention of the 340B program was to cover at-risk populations who couldn't afford their drugs, and to help hospitals and pharmacies who covered at-risk populations to cover those costs. Okay, so the 340B program initially said if you are covering populations that are at risk, that the big drug companies have to sell to the big hospital systems and the big pharmacy companies their drugs at a deep discount.
What resistance are you finding from the legislators in Washington about making it more transparent?
Typically, we find state legislators who say, well, I know the problem is flawed. I know there have been episodes of fraud elsewhere, but I need a way, without raising taxes, to fund my rural hospital system or my local hospital system. As states look at expanding the 340B program, I think insisting on transparency and insisting that the program is used to serve the people it's intended to serve. If you're a big hospital system and you take that money and you're not serving the poor, you ought to be held accountable for that, right? We don't oppose the 340B program for its intended purpose, but we do oppose its abuse. Nobody's against research. But there are ways to fund research that don't include taking more out of your pocket and not giving you the savings that were intended for you, right? Number one. Number two, there may be some research going on, but the profit reports of these companies every year tell a much different story than they're using it for research. What it says is there is a program that was intended for at-risk populations, and instead it's putting $6.5 billion in the pockets of some of the biggest healthcare companies in the country.
No doubt healthcare costs are growing up in the communities, insurance premiums, hospital costs, and we are not seeing better services in the community. It's outrageous that I cannot ask a pharmacist about rebates or how can I lower my costs. There are markups happening in our hospitals and healthcare systems, and discounts that are not being passed down to our patients in our very own communities. As we said over and over again during this conversation, we need more transparency because it is raising prices for all of us, which will lead to small businesses being unable to keep up with this cost. I want to thank Julio for coming and sharing with us so much knowledge and your experience and your expertise and what you're seeing around the country. We're in the Bronx, and we by far, New York City, think that we're alone. But your comments and your experience actually speaks volume that we're not alone. And the struggles, especially on healthcare, is a national struggle. So thank you for being here. Gentry, I want to thank you for continuing to educate and being able to put such a complex issue into such simplicity that A, makes us wonder, B, help us take a look at ourselves as individuals, and C, gives us a moment of pause to think about how do we, as small businesses, as the leadership of the chambers, begin to really think about taking this to the next level. And that's an advocacy effort that says we definitely need transparency, we need accountability, and we need reform. Thank you for being here.